Glad you're here watching my video on YouTube. The fact is, I don't know how long this will be up, since YouTube has decided to start censoring me and pulling down my videos. But don't worry, you can watch this video on rumble.com/randpaul, where I post all of my content. Love to see you over at rumble.com.
Rand Paul joins us now. Senator, he was pointing the finger at you, you and Senator Cruz, I guess, because you guys have held his feet to the fire. What about science is Dr. Fauci exactly? I'm confused.
Well, I think people should really be startled and alarmed that someone in our government, a government bureaucrat, would claim that they represent science. That the implication is that any kind of argument or any kind of discussion sort of is off limits because he is the representative of science. So I think this is very alarming, very worrisome, and also goes against really the grain of what science is about. Look, I've been going to conventions, medical conventions and scientific conventions my whole career, and there's usually debate, there's discussion, there's evidence presented on both sides, and the truth is arrived through disputation. It isn't sort of come down as an edict. The problem also is he's ignored the science. Over 100 million Americans have had COVID, and yet he completely ignores this fact. In all likelihood, thousands of people have died around the world because he said everyone should be vaccinated equally instead of trying to prioritize the vaccine for those who have not yet had COVID. What he's doing is he's delaying the ability to target the vaccine to people. So in India, where 1 billion people need to be vaccinated or want to be vaccinated, and they have a couple 100 million vaccines, if you give everyone the vaccine equally, you're actually not getting it to those who are most at risk because he's not acknowledging that the people who've already had the infection don't need the vaccine. That kind of ignoring of the science has actually cost us lives.
Science, I'm not a doctor, you are. Science usually has an hypothesis. You test the hypothesis with data, and you analyze the data. Take a listen to to Anthony Fauci when he was asked about this Omicron variant. Before even knowing what the data is going to show on this variant, he's already concluded that, as you point out, national immunity doesn't matter, and possibly, vaccines don't matter. Take a listen.
It also has a bunch of mutations that would suggest it could evade the protection, for example, of monoclonal antibodies and perhaps even convalescent plasma for people who've been infected and recovered, and possibly vaccine.
So there it is, Senator. Before he even knows what the data is going to show, he's already concluded that Omicron is going to evade monoclonal antibodies, natural immunity, and likely the vaccine. What's he telling us?
But he fails to mention the one thing that also could be true, but not yet known, is that perhaps this new variant actually is going to be much less deadly. It may be more transmissible, but less deadly. This is the course of a lot of viruses, as they become more transmissible over time, but less deadly. We could get lucky. We don't know yet, but some of the initial reports out of South Africa are that the symptoms are mild and that they aren't having hospitalizations based on this variant. So I think we have to wait and see what happens. The one thing we should be open to, though, is allowing new vaccines to come on the scenes. One of the great things President Trump did was get the first vaccine out in record time. But we now know that more people died last year than died in the first year of the pandemic. So in Joe Biden's first year as president, more people have now died than died under President Trump. The thing is maybe that's because the vaccine is no longer as effective, and maybe we need to allow a new vaccine to be developed. I've already said that even the Delta variant, we should have allowed a new vaccine to come forward. They have it. They've had it under trials, but no one in the Biden administration has been very excited about getting the new vaccine forward. Whether or not we'll need a new vaccine for Omicron, maybe, but we get a new vaccine every year for the flu. Maybe we need to allow an easy adaptation and a moving forward of a new vaccine as they become necessary. But I don't think we yet know with Omicron. It may be that this variant from South Africa may turn out to be less deadly, but we need to wait and see the facts before we go crazy with any prognostications from people like Fauci.
And Senator, help me out here. So Here's how this is going down. Now, Fauci wants to be called Dr. Science. He's all about the science. Yet we now know that the Biden administration declared a travel ban from 8 countries in Africa, but to go into effect 3 days later. On Friday, they said we'll go into effect on Monday. When asked about that, President Biden said, well, I was taking my cues from Dr. Fauci. So Mr. Science says, yeah, we'll do a travel ban, but let's wait 3 days. In the meantime, tells the Today Show that this Omicron variant likely is going to be resistant to monoclonal antibodies, natural immunity, and possibly even vaccines. What kind of science, what kind of scientist is Fauci?
You have to realize that when Fauci says that he is science and that we shouldn't challenge or question him, most of the things he gives edicts on are not based on science and are actually public policy. So, for example, instituting a mask mandate. The science or the evidence we should look at is when we institute a mask mandate, did we have less of the disease transmitted? Well, it turns out that we didn't. With every mandate that was put in place, we actually had increasing incidence of the disease. We have some countrywide evidence in Sweden where they didn't wear masks in school, that they had no COVID deaths among the children, and that the incidence of transmission of the disease among teachers was actually about the same as the general public. So we have a great deal of evidence that masks don't work and the mask mandates don't work. But when he says the mandate is what we should do and now we should have new mandates on this or on travel, he's not basing it on science. It's basically the whims, the capricious whims of Dr. Fauci, which is why we, in a free society, never give that much power to one individual. And it's a huge mistake to let one individual have that kind of power over the economy or over science or over public health.
Well, great news, Senator. The capricious whims of Dr. Frankenstein, Dr. Fauci. Senator Rand Paul, thank you for being here.
Thank you.